Hello everyone, today we are going to discuss a case of patient named Suresh who came with complaint of pain in ankle, especially while going from mid stance to terminal stance in gait cycle. Upon examination, we found out that there is definitely excessive pronation of the subtalar joint, and along with that there is also pes planus deformity present. So now tell me, because of which muscle weakness this can happen to the patient? Option A, flexor digitorum longus. Option B, tibialis posterior. Option C, abductor hallucis. And option D, extensor digitorum longus. Now, my dear friends, before going through the options, we need to understand, yes, many of you have understood that this is a case of flat foot. And yes, we have already understood that there is a problem from going from mid stance to terminal stance. Now, mid stance to terminal stance means what? The movement which is happening in your hip and knee, that we have to just focus. Mid stance, what will happen? Your hip is neutral, knee is also almost completely extended, and from this position, now hip and knee, like hip is going for extension and knee is also going for flexion, and ankle also going for plantar flexion. So this is what we have to understand. This is a situation of mid stance to late stance. One more thing to understand, pronation movement. Pronation movement is what? So pronation movement is combination of eversion and abduction of the foot. So this movement is happening in the foot. We need to find out because of which muscle weakness this movement can happen. The option first which is given to us is flexor digitorum longus. Now flexor digitorum longus, we all know it performs mainly what? Toe flexion. Now does this muscle has any connection with the excessive subtalar pronation or flat foot? Do you think that if this muscle is weak, it can cause flat foot or excessive pronation in the foot? I think not, right? Because this muscle just purely performs flexion of the toe. It has nothing to do with the excessive pronation of the foot. Remember, here the question is excessive pronation. So that is not going to be the suitable answer. Option B, which says that tibialis posterior muscle. Now tibialis posterior muscle comes from where? What is its action? Now posterior means it is coming from the posterior compartment, and it is also connecting in the anterior medial side of your navicular as well as calcaneal bone. Now what does this muscle perform? Does this muscle have some importance of preventing excessive pronation of the subtalar joint? Yes, this muscle has it. Plus, this muscle also help you to maintain the high arch of the foot. Nothing to forget, yes, this muscle helps you to maintain the high arch of the foot. So that means it is also preventing flat foot. So that is why this option looks more promising to me, but don't get too excited. We have two more options to see. Option number C says that abductor hallucis. Abductor hallucis muscle means what? This muscles mainly are going to perform abduction of the toes. So does this movement or this muscle going to prevent your excessive pronation or prevent the flat foot of the foot? What do you think? No, right? This doesn't have direct connection with preventing flat foot or excessive pronation. So this option also we can easily eliminate. The fourth option over here is, my dear friends, that it is telling extensor digitorum longus. Extensor digitorum longus, by the name itself we know it is going to perform toe extension. So this is kind of extensor compartment might be possible, but this muscle purely and purely performs what? As it is digitorum longus, it is performing your only toe extension. It has nothing to do with the excessive pronation, or yes, something to do with the arch of the foot, but nothing to do with the pronation. So that is why this option is partially correct. We can easily eliminate this one too. So the remaining options, the correct option what we have seen so far is option B, tibialis posterior muscle. I really hope that you all have understood that why tibialis posterior muscle is correct. And if you still have any doubts about it, do let me know in the comment section. And for more and more cases like this, subscribe Physio Trendz channel.